My name is John Conley, and today we're going to be talking about the challenges to patient engagement of healthcare technologies. Let's get started. Some of the presented issues. One of the biggest factors in today's medical world is convenience. In a world where people are more involved in their work and less available, convenience is a must. Patient technology must have the following to be suitable. In the medical world, transparency, accountability, speed, convenience, and effectiveness, and the ability to learn are a must. These attributes are what increase workflow and better patient care. But where do we find all these in one place? Some of the background of technology. In the past, and even still today, most doctor-patient relations convene in person. First, you schedule an appointment, then take time out of your day to attend your appointment. Attending will include paperwork, questions, and waiting for your visit. Second, you will be evaluated and/or will talk about your patient health. Third, you will leave your appointment and go about your own business, knowing that the time you spent may have been frustrating or inconvenient. This methodology is losing its edge and forcing people away. It has been surpassed in forcing patients away from their original routines to find better outlets for healthcare. The healthcare industry is in dire need of technology that connects patients easily to their needs. Some of the new advancements. In recent findings, research has explained that new advancements being made to patient engagement technology will not only better the experience but allow for increased quality of care. The new tools being used and constantly updated contain attributes such as navigations, capabilities, chronic disease support programs, and secure messaging portals. Quick access to these assets has put patients in the driver's seat by using their computers, smartphones, and tablets. The main goal is to make these technologies more personal, convenient, and interactive. Continuing, research has shown that patient involvement using these technologies has raised satisfaction scores. Patients' ability to access data using EHR systems has prompted patients to look for providers who offer this capability. It was found that 84% of patients preferred this advancement because of the convenience factor and the ability to talk with their doctor quickly. Resulting from this quick access, it was found that 92% of patients felt hindered by the inability to access their own medical data. From here, I will show you one of the systems that has been created and used quite frequently. This company, Impulse Mobile, uses computers, smartphones, and/or tablets to communicate from patient to doctor. They use an AI system to ask questions and one-on-one interaction to put you in the right spot and to make doctors' visits more convenient for you. By doing this, they have streamlined and made it quicker to get health care that is needed when you're busy, whether you are out of town, at work, too sick to leave your home, any sort of matter like that. Continuing down the page, we'll just show some of the things that they are working on. Leveraging data to guide conversations of such. They use that to update the program to help guide patients through the actual system to get to where they need quicker. This is a plus for all of us. And here are just some more following things. We'll go back to the slides here. Continuing, we'll talk about some of the challenges faced by using such patient technology. Some of them are cost, many different platforms, consistency, and accepting change and legacy submission. Cost is always going to be there. One of the biggest worries is that insurance carriers may not pay for such visits that are all online based. Even though it may be a part of your insurance policy, this has been a factor in making sure that patients are getting treated correctly and are receiving the correct amount of money to be able to pay for the visits. Some of the many different platforms that are used by different doctors have created problems with communication between data portfolios. These EHR systems are great, but communication between different doctors is an issue, and that's why this platform and many other platforms and EHR systems are always being updated so that the consistency across all the platforms stays the same. Accepting change, a lot of people that have been going to the doctor, making visits by scheduling appointments in that matter, are used to that. And for this younger part of the generation, we are very busy, don't have time, and in most cases just can't take care of ourselves. So we need something that is more convenient, such as using these EHR systems and these different platforms. Talking about legacy, doctors are less willing to change to these kinds of programs because they want the people that they've been treating for years and years to keep coming back to them. It gives them a good, reputable name, and it ensures that their business continues to grow. Investing time to make sure that all these insurance policies are covered, consistency is the same, and accepting change is going to be a big thing to swallow when it comes to growing in this industry. Concluding, new patient technology is raising satisfaction scores for patients and making it easier for doctors to provide fast, high-quality healthcare. Some problems arise with accepting this sort of system when it comes to healthcare, but many of these issues are outweighed by the future benefits. Such technology will make healthcare more readily available in a world that never stops moving. Most importantly, patients and doctors' convenience will be improved, and this is the main concentration for when it comes to improving technology communication systems between doctors and patients. Thank you so much for listening. Have a great day.